Hello, thanks for joining Agentic Pathcast. I'm your host, Nick Kabanev. In this episode, we're talking about how agentic automation can help the public sector, not as another technology trend, but as a practical way to reduce backlogs, improve citizen services, support case workers, and modernize operations under real budget and trust constraints. You'll hear and watch my conversation with Alex Michalchuk, Senior Vice President of Customer Engineering at UiPath, on where AI agents, automation, and orchestration can make the biggest difference in public services. Let's dive in. Alex, we discuss a lot of enterprise companies, how UiPath help them, but there's also a public sector, which is really important, and UiPath helps a lot of public sector companies today. I wanted to ask you, because there's this wave of AI that is coming and everybody cares about it in the enterprise world, what is happening in public sector? What are some of the use cases that you've seen there?
Wow, so this is massive topic, Nick. We can talk for a week only on public sector. And frankly, public sector is probably the most dynamic business in UiPath customers today. And we are helping lots of public sector organizations, automate and implement and get into the AI world. The reality of public sector is there is pressure everywhere on public sector. Why? Population constantly growing, population moving, right? Lots, and we are in a world where population working in different countries, moving around, especially in the European Union, right? It's quite dynamic. That creates a lot of pressure on public servants, and public servants themselves also. It's a rare breed today. Why? A lot of people that were working as a lifetime, right, in public sector, they are getting into pension, they're retiring, right? And the new generation don't really want to work in public sector, right? Because they want to work in a dynamic, fast-growing environment and so on. And public sector obviously is not that. It's highly regulated, highly processed, and it's by law, right? It's regulated by law. So therefore, there is these two constant pressures. Increase in volume of transactions of any type, right? Also citizen-related, but also back-end and back office, are also lack of capacity to deal with this. So therefore, making public sector the perfect scenario for automation. And obviously AI, because it's very complex, right? Running a public administration is super complex system.
Yeah.
And you'll see that in public sector, most of the initial use cases, you will think, oh my God, this is so simple, right? It's simple automations, like just inputting this data from the citizen or from a form, right, to this system. So yes, we start with that, and we're doing that for many administrations in many countries around Europe and United States as well. With probably the United States is the biggest sector, right, for us in public sector, the biggest business. But then you also move to more complex, right? And the beauty in public sector is that as the entity that you're working for sees the potential of automation, they just floods the gates with like many other use cases, and it's more as complex and so on. Yeah, you're looking into the healthcare systems, right? They've got really complex issues, like, for example, freeing up beds for interning people, right? And it's a real one that are working. Typically, the real beds free themselves, let's say, in an average of 3 to 4 days. However, scriptically, freeing them takes 7 to 8 days. Wow. Because of complication of systems, forms that need to be completed, validated by doctor, nurse, insurance company, and so on, right? And that's where we are helping, right? To actually get that exactly at the time when the bed physically frees up. Yeah. That can take the next patient, right? We could look at what happened in COVID, where you had a sudden spike, right, of vaccination forms and so on. UiPath helped public administrations, even here, right, in the UK, to deal with that volume, right, by automating them. Then if you move to the new world, right, of case management, orchestration, suddenly you see, right, everything in public sector, like, for example, how do you call this, reclamations, claims, right, from citizens. like to the park and green administration. That's a case, right? And typically by law, they have to respond in sometimes, depends country by country, 15 days, 30 days, and so on to the citizen, right? That was a very complex and capacity consuming process because it has to follow certain steps. Now we're implementing case management for a lot of these authorities and streamlining that and not responding in 30 days by law, getting a response in 2 days, which is a fantastic impact on the citizen, right? I want to go there, but for example, police cases, right, which take forever and bureaucracy to move from like local pictures at the crime scene and so on towards, completion and getting to court, right, of that. And there's various validations like persons that are known offenders, checking that database, checking this database, which it's forever and so non-value work for the policeman on the case, where you can do that with orchestration, case management, and automation, compresses all that work so you can focus on really getting the bad guy to jail.
Yeah. And there's a lot of pressure on the public sector into, well, what people might say, getting the work done. Why don't we have so many public sector officers, whether it's police officers or doctors that are helping us? And there's a lot of pressure on them as well. If you talk to them, they want to help, but they have to a lot of those bureaucratic processes. I think one of the really good examples lately has been the clinical coding agents. You go to a doctor, and sometimes because they have to go through all the systems on their computer and actually analyze what your problem is and how to code it specifically into the codes that everyone in the medical world understands to be able to treat you, they spend 7 minutes out of the 10 minutes that you have with them just working on the computer while not being able to speak to you and understand what the real challenge is. And this is a huge problem. How did your hub solve that?
So that's exactly and I went myself to this case, right? I took a surgery last year, and it was so complicated for the doctor to create this code because certain conditions are very close coded to each other, especially if they're in the same area of expertise, right? And that code is so much necessary for my insurance, right? To pay me back, right? That cost. So I went exactly myself to this, but UiPath right here is doing this with an agentic solution, right? Where there is an UiPath agent that goes and understands the condition and maps it to the right clinical code from the international, clinical codes database, which is for an RPA or for a human being would have been almost infinite loop, I would say, of searching. Yeah. Because it has to, in an RPA world, it has to take word by word and then looking for a code, going to the next. It was like in technical terms, a huge switch, right, of executions. While for a human being, it's just eye and brain consuming, looking constantly through multiple systems to find that code. And then you can do a mistake. You can be tired. You can copy the wrong code. Right? Which creates a problem on the patient because the patient will not be reimbursed by insurance.
Yeah. And looking at the bigger picture, there's also a challenge with the, this translating into the time, the queues that people have to wait for because, you cannot solve all the problems with the amount of people that you have. And then you also mentioned the problem of not that many people want to work for public sector nowadays. So solving those bureaucratical challenges with new agents that we have right now tremendously help the public sector.
And all the paperwork and all the, look, for example, we spoke a lot about healthcare, right, and public healthcare. The only value add activities in this sector is the time spent with patients. That's the only value add activity, right? So you want to maximize that as much as possible. Like also in my world, the most value add activity is customers, right? Talking to customers, right? So anything else, like from waiting time to form completion, to form submission, to research and stuff like that, you want to automate, right? For the benefit of the patient. I'll give you one more example, which is very, very much, I probably, there is no 1 week that passes by for me to not encounter that with a public sector customer. Acquisitions, public acquisitions, which is huge. Just imagine, in any type of public sector entity, how much acquisitions there has to be. And it's all regulated with tenders, offers analysis, analyzing 3 different offers from 3 different vendors, at least, if there will not be 15 to analyze, right? Qualifying them, scoring them, right? We are offering all these solutions right now for these public sector customers to streamline their acquisition processes. By the way, with our acquisition in PKI, streamlining their inventory. Okay, so it's all connected.
Yeah.
Right? So we're also offering this kind of vertical industry solutions specific to this.
Speaking about NHS in the UK and the stuff that inventory management can help with, there are so many NHS trusts in the UK, and sometimes you wouldn't know that, but in the next trust to you, which is probably half a mile away, there is already an amount of valuable things that you can get for your surgery here. For instance, prosthetics, right? And if you knew that, you would have just asked them to give it to you, because maybe they have too much stock and they can share that with you, or maybe they can know that you are out of stock and they can share that automatically. But because there is no connection between those systems and no one is looking at this, holistically.
And look, to me, UiPath is the best position, right, to be the perfect public sector partner, is because we are kind of the only technology vendor that offers all these solutions, from document processing, intelligent document processing, to orchestration, to agentic AI, in the safety of an on-prem deployment, which is very important for many public sector entities. Like if you just look at defense, right, sector, the cloud is not an option.
No.
Right? So, or AI on cloud, or using, straightforward OpenAI or Claude and so on. Yeah. It's just not an option by regulation.
Mm-hmm. You need to bring your own model as well, which is, not that many vendors support.
And we offer, we have Helix right now, which is our own custom model.
Yeah. Alex, it's been a great pleasure to have you on this podcast. As we mentioned, so many topics today, starting from the public sector, but also how the roles transform, how important is it for people. We talked about what's important for people and how the future is going to look like, at least from your perspective, right? And we talk about how UiPath solves real, tangible use cases and the outcomes of that. So it's been a real pleasure to have you on this podcast. Thank you.
Same for me, Nick. It was amazing. I can invite me anytime.
Well, thanks for joining this episode of Agentic Podcast. The big takeaway is that public sector transformation is not just about faster systems. It's about helping people deliver better services, with automation and AI supporting the work behind the scenes, while keeping transparency, accountability, and trust at the center. I'm your host, Nick Kabanov. See you in the next episode.